Okay. Good morning to all. So myself, Vipin Sharma, and I'm from the InnoFact show. I would like to welcome all of you to the webinar, which is for the topic Survive, Revive, Thrive in the Hospitality and Entertainment Industry, Government Initiatives. So today we are going to talk about what are the government initiatives and how the government is helping to revive the hospitality and entertainment sectors. So with me, we have Patricia Ollinger from GBack. She's the executive director of GBack, and we have Charles Papas from the Exhibitor magazine. So they are going to share the knowledge about the subject matter, and I'm just passing the dice to Patricia Ollinger to take it forward from now.
Thank you very much. You know, uh, I'm looking forward to our talk today, and I appreciate the opportunity to talk. We've seen so much over this last year with the initiatives from our governments and from different agencies providing some guidance. At GBack, the Global Biorisk Advisory Council, we're a division of ISSA, and ISSA is the world leading trade association for the cleaning industry. And we represent over 10,000 individuals or companies. And, we're into 105, I think, different countries. And it is really the manufacturers, the distributors, the service providers, and organizations and companies. We had to pivot very, very, quite a few times last year. Our training went from very boutique, hands-on, high level with GBack of response to infectious diseases to online training very quickly. We went from that to my background is in management systems and biorisk management systems. I happen to be the convener for ISO development of international standards on biorisk management. And we developed a program to help facilities move forward and actually not just move forward, but to be prepared for what may come next. And our accreditation, our GBack Star accreditation program helped organizations look at these government initiatives, identify what they needed to be in compliance with, look at the hazards, do their risk assessment, and put in place programs to help them reopen. We have over 3,500 facilities worldwide now that have committed to the STAR program, and now with service providers as well. And what we're finding is that, there are certain industries that have been very, while every industry I would say has been hurt and hit, the entertainment industry, the hospitality industry, the sports industries have really been hit hard. And I will have to say that our experience with working with these industries, they have put in place programs to help reopen in a safe manner. And in some of them, like the sporting industry, who with here in the United States, the National Football League, the National Basketball Association, they did an amazing job putting in place programs to be able to still hold games and open safely. Charles, do you have any thoughts?
Oh, I have a lot of thoughts on this. When you talk about hits to industry, of course, at Exhibitor magazine, we cover the exhibition industry, which is probably the worst field I could have chosen to be in for 2020 because it depends on mass gatherings. And there's one estimate from the Center for Exhibition Industry Research that indicates we lost $84 billion last year. That is out of a $105 billion industry. It was massive. And of course, the longer it stretches on, the worse it gets. Now, you're right that some events we've been able to pull off. Recently in Florida, there was the Surf Expo, and there were about 3 clothing shows that occurred in Orange County. Mm-hmm. They seem to have been relatively safe using masking, social distancing, temperature taking, et cetera, and even some health screening. That is, you report your health and then they would screen that form. That does seem to work, but they do seem also to be stopgap measures. And I guess the question now is, how much will government stimulate? How much will government steer what's going to happen in the rest of this year and the year after that? That is, how much is going to be carrot? How much is going to be stick?
That's a really good question. And, what we're seeing in different countries is, well, first of all, this pandemic is not going away anytime soon. And we recognize that with the variants that are coming on board or that are starting to pop up. If you look at Canada, they're going down, like Ontario just went to a 4-week shutdown as of last night. We're seeing other pockets of variants coming forward. The vaccination rates in different countries vary from country to country. And so some countries, to go to, you're going to end up being quarantined for a while. You mentioned Orange County in Florida. They actually I went to the, Together Again Expo back in August of last year and watched, just because it was one of their very first exhibitions to go forward. And, they had an NCAA AAU volleyball tournament as well back at that time. And some of the stopgap measures that they have put in place aren't really necessarily being dictated by their governmental agencies, but to ensure that their governmental agencies, local governmental agencies, are comfortable with them being able to reopen safely. And, whether some people feel excessive, some people feel that they're necessary, it's necessary to get them back up and running. And it may be a short term, and I think that's what we're going to see in the future of mass gatherings, is some short-term initiatives to give that confidence and the trust that they can do this safely. And then we're going to see some long-term initiatives as well that will be in place as we go forward.
Well, what I'm thinking is a lot of this might actually go back to a 115-year-old Supreme Court decision. There's one called Jacobson versus Massachusetts in 1905, which seems completely irrelevant. But what it held is that government can mandate vaccinations for certain limited uses. Now, that's different from, can government force everybody to get a vaccination? No. But for instance, a venue, a job can say you can't go here, you can't work here unless you're vaccinated. And I think we might see some aspect of this working itself out in some states, as well as a so-called vaccination passport, which could be literally for travel or literally just to enter a place. I think we might see some of that. Now, the United States has devolved that to the states. In other words, Florida can do it if they want, but they've said no. Texas has said no. New York, however, is now working with something called Excelsior, which is a passport connected to your medical records. You go to a place, they read a QR code on your phone through a smart app, and it says, you were vaccinated on such and such a date. I think we're going to see some of that in some pockets, and also travel itself. Now, right now, Israel has a vaccination passport. China, the EU, and Japan are considering it. And this to me, this is not a no. There used to be the so-called yellow card from the old days where you would write down what vaccinations you got to enter such and such a country. I actually had one of those. This might be a version of that we might use to travel safely. And right now, the International Association of Air Transport is trying it with, I believe, about 25 airlines, if I'm correct, like Emirates, Singapore, and a few others in Europe to see, if it works, iron out the kinks. I see that as being in our future to some degree, though again, in the United States, because it devolves to the individual states, that could be problematic. And the World Health Organization says no to that because they feel it's prejudice, if you will, against countries that are not able to access vaccines in the way the US is right now, which is a good argument. So how do you see that playing out?
Some countries are definitely, going to be having requirements. If you want to enter in, you're going to have to show the new version of, say, the yellow card. I think that we have seen in some of the work that I've done in other countries, especially developing countries, and I shouldn't say especially in developing countries, you see it in developing countries to be able to track vaccinations. It's very difficult to track vaccinations. And if it's on a paper card, it can be lost. And I'd say, I mean, if you think about even here in developed countries, you send your kid off to college and if you've gone to multiple different pediatricians, getting their vaccination records can be challenging. So on one hand, having a what we call virtual passport or vaccination passport that you can put all of your vaccinations in, including your COVID-19, there's some value to it. I think that you're absolutely right. Here in the United States, each state can dictate what vaccination requirements and what they are going to allow and what they're not going to allow for exemptions. And we see a variation. Some industries will. If you look at the healthcare industry, many hospitals require that their physicians and nurses and their support staff all have flu shots every single year. It's not with the exception if you can't have it for medical reasons, say. My son's a resident. Both of my sons are residents, and they were basically told if you have to have the COVID-19 vaccine unless for medical or religious reasons. So we are going to see that, and I think we're going to see some of the shows that you referred to, the fashion shows, actually required you to be tested prior to going into the show with the COVID test. They haven't necessarily shown to have to go into, sorry about that. They haven't shown that, you have to go into, having, how do I want to say this? The vaccine passport, nobody has really gone to that level except for travel that I've seen so far, with the exception of New York is exploring it.
Right. And part of it too is I think there's other governmental aspects. For instance, in January, the CDC started needing people coming in from international spots to have been tested for COVID and show negative 3 days prior to their flight. The CDC might also, let's say late spring, I'm wondering, might give kind of an all clear for travel again. I mean, they're sort of ambiguous about it now, but there might be more of an official statement that air travel is really safe again. And I suppose that would coincide when we get to the 200 million doses of vaccine given out, something like that at that point. The other thing I'm thinking though is that, again, it comes down to the states. So let's say, for example, Governor Sisolak in Nevada opened up on March 15th, Nevada to events that could hold 50% capacity, or I believe 250 people, whichever number is less. And they had to submit a safety plan to the state government to show how they could do it well and properly. Now, as of, I believe, May 1st, he wants that to devolve to the local governments, meaning, for example, Las Vegas could decide what's safe and what's not to open up their trade show and convention industry again. Similarly, in California, Governor Newsom has decided that he wants the state completely open by June 15th, if I remember correctly. So that again is for conventions, that's going to be huge. By the same token, if you look at the top states with new infections, you're looking at California, you're looking at Florida. So, that's playing into it as well. And with the, especially the variants, especially the B117 variant being really the one that's really hitting people hard now, how that plays out, we can't tell except for, over the next month or so. So it's great, light at the end of the tunnel, and you still have to be concerned. We have these kind of conflicting ideas, and you really can't say which is going to predominate at this point, I think.
Yeah, absolutely. And people are really, they're tired. And we know that this is that pandemic fatigue is happening. I think we're seeing that in some of the states here in the United States that are opening up. Those who have been really tied down, they start to open up and everybody's like, oh, it must be okay for me to go out in public now. And now we're starting to see the numbers go up again. I can't stress enough that this is not the time to relax. This is the time to stay, diligent and vigilant. We as individuals can control a lot of our own personal exposure, whether it's social distancing, staying home, whether it's when we are out in public, being very aware of those potential exposure moments. Washing our hands, wearing our face masks is really important. And when we think about some of these mass gatherings, and we can do it safely, but we have to do it in collaboration and partnership with our local governments, with the facility itself, with the service providers that do the cleaning, disinfection, and infection prevention measures, and with the event planners. It's very critical that everyone understands what types of programs need to be in place, what the local government is going to request of them, and then be able to verify and validate that they do have the programs in place through third-party evaluation, such as GBack Star or some of the others that are out there on the market, but ensuring that they have thought about it from a systematic approach, to be in compliance as well as to be able to reopen safely.
I think you made a really good point there about even if we get vaccinated, we still have to watch for the usual safety procedures because we still don't have enough evidence as how many viral particles can you carry, even if you're immune to them?
Mhm.
How many can you transmit? The early reports look very good, but that's early reports. We still need another 6 months, a year to get a better handle on it. So I think we're going to still see, as you said, masks, social distancing. We're still going to see maybe some temperature taking. The crowd density standard, which is basically you take your square footage, you divide it by 28, and that's how many people you can safely have in a space. While not every place may be exactly the same, I think we'll see some versions of those at different conventions and trade shows around the country to still be safe. You can feel safer if you've gotten your shots, that's for sure. But again, this is going to be something that's not a light switch that goes on and off. It's more like a dial that goes from dim to bright and brighter as we go along, I think.
Absolutely.
Let me ask you something about what you feel. I've kind of been watching what the government stimulus has been at this point, and there's some interesting work being done. Now, besides what state governors can do, there's the Sustaining Tourism during the COVID-19 Pandemic Act, which is not official yet. But it's a bipartisan act that Senator Masto of Nevada has tried to push through. And some of it will help pay for actual physical modifications to convention or trade show facilities, as well as even pay the salaries of people who are involved in ensuring better safety. And then hand in hand with that, there's a Hospitality and Commerce Job Act, which kind of interestingly would give tax credits for hosting or sending people to trade shows and conventions. Now, again, that's only in the preliminary stage. They haven't been passed, but I'm hoping that those may in some way kind of be more, again, the carrot in this instance. Because right now, according to our data, about 75% of event and exhibition professionals still have company-wide travel bans. I think it's a good metric. So you can get from that how many people, how many places, how many businesses are actually willing to travel at this point. When that starts going down more, I think that's a really great indicator of the industry is coming back to life, it's being revived.
That's a great metric. You're absolutely right. I mean, when we start see that number starting to come down, it's an indication that both, companies are willing to send their folks. The other thing, that we're seeing that when they do send folks, where they may be used to send 10 people, they're only sending 1 or 2.
Yes.
And so the numbers are much lower, partly probably because their financials are lower. And so they have to be concerned about that. Also, the less risk, the less people you're sending, the less risk. So yeah, that would be a great metric to keep track of from that standpoint.
You said something kind of interesting here, Patty. You talked about risk. And I think that's the next sort of final frontier of this. Part of that reason that people aren't traveling is, what's my legal liability?
Mm.
And until that's addressed, now right now about 12 states have individually addressed it in different ways. But at this point, there's been something like 2,084 lawsuits filed. 164 of those are class actions, which means big. And early on, it's been, hospital facilities, healthcare facilities, cruise lines, for obvious reasons. But I think that sphere is going to expand and include potentially convention facilities, because if you get a CES with 170,000 people attending, and even if 1/2 of 1% got ill, well, that could be a huge liability for them. And one research firm called Predicate has said their worst case scenario is that businesses will be hit with 21 billion in losses due to lawsuits. So right now, the Safe to Work Act is languishing in the Senate, which would basically be a uniform countrywide, addressing of liability. But apparently what's holding it back is, according to some interpretations, if all you do is write up a safety protocol for your business, that means you've made a good faith effort and you're off the hook. Well, I can see why people would have problems with that. But on the other hand, we do need liability protection. So how do you see this working out? What's your take on it for the near future?
You're absolutely right. Some states have done different things. Georgia, for example, is one of the states that's, you see it in the businesses as you walk in. If you're walking in and you potentially get COVID, you are taking risk into your own hands. We've seen other organizations look at infectious disease riders, because a lot of insurance companies do not cover events that involve infectious diseases. And if you have, if you're going to be able to get an infectious disease rider, you not only have to have that plan in place, or a program in place to address potential outbreaks and pandemics, you have to be able to show that you actually have implemented that plan as well. So an auditable, let's say a program implementation. And, so those are the types of things that what we talked about very early on, what will stay with us. I think we're going to see some of the impact of, the insurance company, the liability issues, in collaboration with whatever the government puts in place in whatever country you're in, as well as, your own lawyers and everything, deciding what is our relative risk and how are we going to ensure that we have something in place or manage, programs in place to mitigate that risk as much as possible.
Well, in many ways, isn't that really in a way where GBack comes in? With a certification like that, it does mean a facility has done a thorough, good faith effort to address, the health concerns in whatever way possible. So there is a standard you can go by. There is something you can look to, other than some guy saying, yeah, it's fine.
Absolutely. It's based on quality management principles. It's our GBack Star accreditation program. And we've worked with, every time we think we find what we call a vertical, meaning the type of institution, whether it's hospitality or performing arts or sports arenas or convention centers or restaurant spas, we're now starting to get people from events, one single event. How do we, and now service providers. Just when we think that we've identified most of the verticals, somebody else comes forward. It's been quite humbling to work with folks, but you're absolutely right. It gives them that comprehensive quality management systems approach of continual improvement. Where are we today? Where do we want to be tomorrow? What do we need to do to put in place the program so that we can, continually improve and be able to provide that confidence and the assurance to our governmental agencies, to our employees, and to our communities that we're ready to reopen.
Hey, let me ask a personal question. If you were are you fully immunized yet, by the way?
Yes, I am.
How would you, given that, if you went to an event, such as in the trade show industry, where there's a considerable number of people, How would you like to see it handled? What would you like to see if you go to one in terms of how it's set up and how they're addressing health concerns?
Oh, that's a really good question. I am fully immunized, and I mean, right now, I had indicated earlier, you're going to see some short-term measures and some long-term effects. And so from a short-term standpoint, as we start to reopen, I think the whole onboarding of people who are going into the event themselves needs to be looked at. Are we temperature monitoring? Are we verifying that someone has been tested, or even the vaccination status? That may, and this is some discussions that are happening right now, that may play into cleaning schedules and disinfection schedules and indoor air quality issues that need to be looked at. How the institution itself or the cleaning contractor is implementing programs needs to be looked at. There's a term that people talk about, and in the beginning, and I've been one of them that looked at it as a very negative term, and I'm starting to see it a little differently, and that was hygiene theater. And, initially it's like they're just doing that to make it in hygiene theater. There is a confidence level associated with that too. You walk into a facility and you go into the restroom, and if it's dirty and messy, it's going to give you a feeling for the rest of the situation. If you're looking for hand sanitizing stations and you can't find them, it's going to give you a feeling of not safe. If you see the cleaning crews out sanitizing and disinfecting the high touch points, like the handrails and the buttons on the elevators, it's going to give you a little bit more confidence that things are in place. And those all go into what they actually are doing from an accreditation standpoint. Do they have those systems in place? Are they actually implementing what they say on paper? That's a huge issue. And then are they looking at how they can improve going forward? We're seeing some really unique, I would say, if there's a silver lining of this pandemic, some really unique technologies that are starting to come down that will really, I think, be in place as time goes on. And it's things with the HVAC systems and the indoor air quality, how we distribute sanitization and disinfection materials and chemicals in a more effective, efficient way. It's an evolving process. And again, short-term initiatives, we're going to be more restrictive. And I personally would feel a little bit more comfortable with more restrictions from a standpoint of people still wearing masks, and everything. And then long-term solutions as well.
You said something great there, though, when you talk about hygiene theater, that I think you're right. Now, the Australian National Science Authority indicated that the virus can live under ideal conditions for 28 days.
Mm-hmm.
Another piece of research indicates that you have a 1% chance of, perhaps less, of catching it from a surface. Okay, I get both. But again, if you're going into cleaning, constant cleaning, it seems to indicate to me you're making a good faith effort to keep it better. It should reflect your deeper commitment on all sorts of levels to keeping it safe. And frankly, if you do clean it, how is that less safe? I mean, even if there's a small chance of catching something, how is it less safe if you're constantly cleaning something? It's good. And that plays into when you talk about technology. And I believe it's the MERV 14 air filtration system, which is getting a lot of press now, which is really effective against viruses. There's things like Stephanie Taylor from the school of Harvard School of Public Health has indicated that 40 to 60% humidity is ideal for trying to thwart the virus from transmitting. Again, that there are these little things we can do, especially with air, that can be extremely effective, that in a sense would be invisible. But if you knew that that facility was doing that, I would have a lot more confidence I'm going to be okay, in conjunction with, as you said, the hygiene theater, so to speak. But it means you are making an effort to keep things safe until, again, we have a much better handle. After 1 year, we're pretty knowledgeable. Another year, and I think we're going to have a much better grip on what's safe, what isn't, who's transmitting it, and how.
Absolutely. No, I 100% agreement. Very much. You're muted.
You're muted.
Yeah, so it's a great knowledgeful discussion that we had, right now, and there are certain questions from the participants and from the audience that I would like to ask.
Please do.
So the first question is from John. He's saying that some states have already introduced legislation making vaccine passports illegal. So what are the implications for meetings, exhibitions, and hospitality?
Well, we had just talked about this a little earlier, and I think the implications are mixed. Some countries may have it, some countries may not. Certain states in America will not allow vaccine passports. Certain states like New York probably will. I think what it means is if you attend trade shows on a regular basis, you might be in Chicago, New York, Los Angeles, Austin, Texas, Dallas, Texas. You might be in Dusseldorf, you might be in London. So I think the default would be you're going to have to get some version of it if you do attend a wide expanse of shows and conventions. And of course, this will have to work out with getting your medical records, making sure you can get that easily, having the correct type of passport, the correct type of record, and being sure that they're accepted in that locality or that country. It's going to be a bit of a mess, but it's going to play out, I think, in a very fragmented sense, which will be another thing we have to put up with, at least for the time being.
Yeah, absolutely. I mean, because obviously there's no one, international governmental agency that's going to say this, because even if somebody, let's say WHO came out and said, or in the UN came out and said, we want this as an initiative, then each country has to ratify it and into their, and then here in the States, you have to then go to the state level. And so it's going to be a bit of a mess for a while. And then you're going to get situations like with healthcare. If you want to get certain type of funding, you may need to implement, this into your institution, like we see with flu vaccines. And it will be very interesting as to how this all plays out. And it'll be a mess in between that. The reality is that as individuals, we do control this information and we can carry it with us so that if we go into New York, we can show that we have our vaccine. If we, go into another state that doesn't require it, we still have that information.
Right. So the next question is related to that only. The question is asked by Amit. So he's asking that is states relying on tech innovations to maintain public safety and contract tracing at large gathering areas like Las Vegas to mitigate the pandemic related issues?
Patty?
Could you repeat that question? I didn't really understand.
So he's asking about is states relying on tech innovation to maintain public safety?
So innovation. I think we're going to see some really unique, innovative ideas, and we're seeing those already. The EPA recently approved a new technology for viral disinfection of the air in just a few states, but I know that they're expanding that approval to other states as well. We're seeing new, innovative robotic type systems that are coming into play. Devices that have disinfection properties and UVC light with collaboration in connection with a HVAC system. We're seeing, one thing that concerns me on some of these devices is it really does come down to also how are we validating that what they are claiming is actually working and how do we do that? And interestingly, on that note, we're seeing new validation methods coming forward. And I think we're going to see those stay with us, bettering our whole industry, not just these industries, but even some of our research facility industries, for example. Those innovations and those technologies that we're going to see coming forward will stay with us. And as I indicated earlier, if there's a silver lining in this, it's that innovative new ideas that we'll see in the future and today.
Right. So another question is also related to you because people are more curious to know what government is doing. So the question is like many countries are doing night and weekend curfew. So in that case, the hospitality and entertainment industry gets a hit. would you suggest some specific measures for the industry, that what measures the industry should take and how they can avoid these situations?
I'm sorry, could you repeat that a bit? It came through a bit muddled.
Okay, so in many countries there are night and weekend curfews. So the people are not allowed to go out in night and on weekends. So, and that is impacting the hospitality and entertainment sector very badly. So what are the measures that this industry should take? So you both can answer this question because both have the knowledge about it. So what are the measures they should take to avoid these situations?
Well, I think we had talked a little bit about how there are some stimulus acts that will pay for people, rather give a tax credit to companies for sending people to shows, or facilities for hosting shows and conventions and events. And since these normally occur in the daylight hours, I think you're somewhat safe. Now, obviously, if you have a show in Las Vegas or New Orleans, the nightlife is part of the attraction. So that obviously would kind of slow down the acceptance. What I think you're going to see is a very chaotic rollout of some cities having limited access to restaurants and bars, not necessarily curfews, but just access for gatherings in bars and restaurants that will slowly fold back over time. So let's say by May 1st, Las Vegas might be fairly wide open. New Orleans is likely to be somewhat more closed. So you're going to have to take it on a city by city basis and see what the local facilities are willing to do and how willing they are to open up in those circumstances. Again, we come back to kind of a mosaic where it's going to, look made of different tiles, and it's going to look different here than it does here. Dusseldorf is going to be different than Los Angeles. New York is going to be different from Dallas, Texas. And that, unfortunately, is one of the problems. It's going to be a pain to deal with for everybody, especially anyone in the exhibition industry who attends a lot of trade shows and events.
Yeah, and on that note, I mean, it's a journey. If you think about it, it's from your door to the location of where you're going to, and back home again. So, the travel to the airport, how the airport is set up, the airline, the taxi services or mass transit systems, the hotels, the convention center, the restaurants. We've had several, believe it or not, Dallas, Texas was our first destination city. And they wanted to make it so that from a tourism standpoint and from a travel and actually from an exhibition standpoint, people felt comfortable coming to their city and looking at that whole journey. And people are going to pay attention to that now, from that standpoint. And bringing your families with you to a convention, it takes on a new idea this time. And the cities themselves are really interested in making sure that people feel comfortable, not just to come to the show or not just to come to a convention, but also to be able to come and feel comfortable and want to see and be there in their cities.
Right. Right. So there's another question, as you mentioned about the sustainability. So there's a question from Nathan Hams. He want to ask that, do you think it is possible to make sustainability compatible with reduced spending and improved service quality in the tourism and hospitality sector?
Absolutely. So when you look at LEED and sustainability issues with LEED or Fitwell or WELL or any of the sustainability areas, when you're doing your, it's a balance. I mean, on one hand, you have to look at what it is that you're trying to accomplish. And first and foremost, with a pandemic, you need to address that risk and that hazard. But you can do that in a way that's compatible with those standards, as other standards as well. So for instance, from a LEED standpoint, one of the concerns that a lot of people and a lot of our convention centers have had that were LEED certified is, if I'm using all this, technology and sanitization and disinfection technology, am I going to, breach my LEED certification? We actually had some facilities in the United States that the disinfectants they were using were not approved for COVID-19. They weren't on the EPA list, and we had to work with them to find things that were on the EPA list that also were on, their sustainability lists as well. And it took a little bit of work, but they found it, and that's getting better. You can do this, It just takes a little bit of research and a little bit of work to be able to do it in a collaborative manner. But absolutely.
I think part of the problem will be in things like HVAC systems, which typically obviously use a lot of energy. So for instance, as I understand it, some of the criteria is changing in terms of, instead of powering down air circulation, when the density of the crowd gets a little lower, you have to keep that up so that air circulates more and more. Now, obviously that uses more energy, but it's a case of weighing, the importance of these factors. Right now, in the near future, I think air circulation would be a little more important than saving energy at this point. By the same token, HVAC systems are getting better and better all the time. And so I think right now, while we may be using more energy for, in a typical lead system, in a year or so, I think that will be ironed out quite well. We're adapting to it very quickly. And I don't even think we have a good sense of just how dynamic and fast this change has been. To get a vaccine in 12 months is an astounding feat. Maybe it should have taken 5 to 10 years. I mean, it really should have by some standards. This is astonishing. The way the technology is adapting is astonishing. And even though, of course, we only can live day to day, and it seems like forever that this stuff is taking, the fact is it's going at warp speed.
Absolutely. And this is not a new concern. The HVAC systems, so I spent a lot of time in research organizations, and when you look at a research laboratory building, they're called energy hogs, just from a standpoint of you have ventilation requirements in research facilities. And our sustainability teams would always come in and say, can we reduce that ventilation system requirement? You can, but you have to then show that you're still providing that protection from chemical exposure and biological exposure to those researchers, which is the number one, to me, safety is the number one issue that we need to address. And, and so there's a balance, and we're going to see that. And in the long run, I think it's going to be better. These new systems that Charles alluded to are much more efficient. They're very controlled. And that's where that innovation is coming into play, that we're going to see some unique things, I think, in the future. And the future of built environments is going to change.
I think the only thing it raises as a problem is, I think anybody who attends shows or conventions might need to add this to their due diligence list. Mm-hmm. I mean, I never before would have thought about asking a convention center in Las Vegas about their HVAC system. But, it wasn't exactly top of mind, right? But now, what's the harm? If you find out it's one of these new systems, great. It makes you and more importantly, the people you may be sending to shows feel that much safer. And you have that much more confidence that this show is not only worth attending, but now you can attend it with some degree of assurance that you're going to enter and leave and be okay.
Yeah, that's an interesting thing, because I think, some of the shows that I've seen, you have the facility itself and potential renovations of the facility, but then you have portable systems now that can, in certain situations, that can be added on during a show. And I think that, again, just like with anything else, we're learning, and there's a lot of testing that's going on. And we're going to see a lot of changes here in the next several years.
In other words, there's a tunnel, and there is actually light at the end of it.
Yes.
Yes, there it is. So the last question of today that we are going to ask is about the health and safety of the hospitality workers. So what government is doing about their health and safety, and specifically about the vaccination to the hospitality sector. Like I've seen some vaccination going on, in Las Vegas for the casino industry that is going on. So I've been seeing a lot of posts coming up from their side on LinkedIn. So what is government doing to make sure that the workers there in hospitality sector are safe, healthy, and they're immune from this pandemic?
I think, Patty, you tell me if you agree with this. I think in a sense, government has already done something good with this by opening up vaccinations for everybody. And I think what that basically means is each state has a little more control over it. But on the other hand, it means that anybody over roughly the age of 16 can in many states get the vaccination. Individual states and individual facilities, I think, have to help people who are in the front lines, not just healthcare workers, but yes, trade show workers, convention workers, because they're working with mass groups of people, help put them in line by whatever means necessary to get vaccinated. Now, I'm a big believer in vaccinations, others aren't. But again, going back to a Supreme Court decision well over a century ago, facilities can mandate that you get a vaccination. So I think those factors playing together can help ensure workers' safety.
So here in the United States, I think you're going to see, first of all, we have our Occupational Health and Safety Association, OSHA. And OSHA has several different policies and procedures that are in place. CDC has guidelines that are out there that talk about different health and safety aspects of need, not just the exposure to the disinfectants, the exposure, the protection factors, whether or not you're going to be wearing masks, the need for respiratory protection. All of those actually have, here in the States, standards. Other countries have standards as well. And so whatever country you're in, you need to understand what your country or local areas are requiring. That being said, we really do have that frontline worker is the one that's potentially the most exposed. And being able to provide that protection to them is really important. We're going to see, and it's going to be interesting, here in the United States, they're talking about a potential infectious disease standard, airborne infectious disease. California has one. I think 17 states now have something in place. We have a temporary standard that they've been talking about. But if we get to a formal standard, there will be an occupational medicine part of that standard. Look at the bloodborne pathogen or human bloodborne pathogen standard here in the States. And around the world, they have multiple different versions of that for their countries. Within that, there's a vaccination requirement for hepatitis B. And you're going to see that if we do get a standard here in the States, you will see that. I'm predicting that portion of that, if there's a vaccine available, how are you going to implement that to your workers and make it available to them, just like we do for hepatitis B. You see that in other situations as well for, requirements. And you'll see the occupational aspect of it become available to workers. And I think one thing that is really critical is the training. Is that we can talk about having SOPs in place. We can talk about how to utilize different chemistries or how to address social distancing and infection prevention measures, but actually teaching our frontline workers what that means to them and how they can implement it safely to keep themselves safe and others is going to be critical. And it's something that we cannot let go away.
I understand that, and that is, what the Charles has been saying, that so there's a light in a tunnel. So everyone is hoping that there's a day on which we'll be able to survive and we'll be able to revive this particular situation. So I really would like to thank both of you to share the knowledge about this particular topic. And at the end of the webinar, I just wanted to introduce about our main show, which is the InnoFact show. And I would like to take the opportunity to showcase one of the video related to our show, and just want to showcase that what this show is all about. is all about the InnoFact show. So we are talking about the resilient recovery of the hospitality and entertainment sector, uh, and where we are targeting a lot of the exhibitor categories and visitor categories to participate and collaborate in this particular show in the month of June, which is 8th and 9th of June. So we want, Charles and Patricia, your support also, and, to support this initiative where we can help this industry to revive.
Thank you.
Thank you.
So thank you for coming on board, and we look forward to have you for more of our webinars.
Thank you very much. Have a wonderful day, evening.
Bye.
Take care.
Bye-bye.
Thank you. Bye.
Bye.